It is October, although you cannot tell from that live shot of Central Park.
Leaves will change eventually.
They sure will. Lots of things that we acknowledge in the fall. October has become synonymous with breast cancer awareness. It's been 40 years since the Breast Cancer Awareness Initiative began, and according to the American Cancer Society, over 500,000 lives have been saved because of it.
And joining us to share some facts about breast cancer treatment and advances is Dr. Katerina Dodelzon, board-certified radiologist specializing in breast imaging at New-York-Presbyterian and Weill Cornell Medicine. Doctor, welcome to the show.
Thank you so much for having me. Such a pleasure to be here this morning.
I feel like this is a topic that almost feels like there's no end in sight, but there is a little bit of hope, I hope. In the 40 years, what have we seen change? How have we seen treatment evolve?
Absolutely. Since the start of the Breast Cancer Awareness Initiative, we have seen incredible progress. First and foremost, we now have more than 4 decades of data, long-term data, that demonstrate consistently and unequivocally that annual screening mammography starting at age 40 and continuing as long as you're in good health saves lives. Yeah. In fact, since the 1980s, we have seen more than 40% reduction in breast cancer-related mortality.
That's great.
Yeah.
Through early advances and through screening.
Screening is so important, really, truly.
So while that is fantastic news, I understand that young women are experiencing breast cancer at a higher rate these days.
Yes, so absolutely. The incidence of breast cancer is increasing globally across all age groups, including young women. And that really highlights another important factor of breast cancer awareness, and that is risk assessment. So all women are recommended to have their lifetime risk of breast cancer assessed by age 25 or 30. So if you haven't already, ask your doctor to have your lifetime risk of breast cancer assessed.
So much has changed because I'm 51. Breast cancer runs in my family. And I remember in my 20s, my doctors did not ask me about that, but now I'm every month, you know, they text me, they call me, they send me correspondence because I think early detection is something that is useful in terms of the research, in terms of figuring out the guidelines. Is the good old-fashioned checking your breasts in the shower, is that still a thing?
It is, but the most important thing is still an annual screening mammogram.
I wanted you to set the record straight because there's some folks that'll say, "Oh, I don't feel anything. I'm okay. I'm good."
So what are some of the new screening guidelines then?
Yeah. So the screening recommendation that average risk women, so most women, should start their screening mammogram at age 40 and continue as long as they're in good health annually. And in addition, again, the recommendation is all women should have their lifetime risk of breast cancer assessed by age 25 or 30 so that if they're found to be at an elevated lifetime risk of breast cancer, they can begin screening at an earlier age and augmented with breast MRI in addition to that annual mammogram.
There's a lot goes into this, a whole lot. Can we talk to me about women of color, black women in particular. How is that particular population affected by breast cancer and sort of managing it?
Absolutely. Just like across all populations, the incidence of breast cancer is rising also in black women. But in addition, there's a gap between the incidence and the outcomes among black women, and the cause is really complex and multifactorial, likely to limitations in access and awareness, but very clearly, biology also plays a role, with black women more likely to be diagnosed at an earlier age and with more aggressive and advanced cancers. This is why at Weill Cornell Medicine at New-York-Presbyterian, we are working to close the gap through research, community outreach, and by offering all women risk assessments so we can identify those that can benefit from earlier screening.
All right, there's a term, dense breast. What is that, and how does that impact screening?
I have them.
Yes, yes. 40% of us have them, in fact. So dense breast refers to the proportion of fibroglandular tissue, or those breast cells, compared to fat cells that we see on a mammogram. The more fibroglandular tissue you have, the more likely you are to be dense. And that really is related to the composition your mother was. So it's a genetic predisposition. And as I mentioned, 40% of us are dense. And what that means is that the accuracy or the sensitivity of a mammogram is slightly lower compared to women that are not dense. And also, your risk of developing breast cancer is slightly higher compared to women who are not dense. So you may benefit from additional screening, such as with MR or an ultrasound, in addition to your annual mammogram. So know your density. That is readily available in your mammogram report and in the letter your breast imaging facility sends you every year.
And gals at home, just give yourself extra time because after you go to have the actual mammogram, you have to have the ultrasound. It takes a long time, but it is worth it.
saves lives.
It saves lives. Last two pieces of advice when it comes to breast cancer detection. What can you tell our viewers?
Don't delay your mammogram.
Yeah.
Early detection is the most important factor in saving lives. And know your risk. Talk to your doctor about having your risk of breast cancer assessed so that you can have more effective and personalized screening regimen tailored to you.
I like it.
Customized directly to your needs.
That's
We're seeing
right.
so much more of that in medicine. That's great.
Thank you so much, Doctor.
Such a
For more
pleasure.
information on breast cancer awareness, go to the American Cancer Society at cancer.org. And of course, be a good partner.
Yeah,
and
I
friend.
encourage it.
That's right.
I'll watch the kids. Go take care of yourself.
There you go. There you go.